And as we said then, this declaration of emergency was about preparedness. It's so that we as a city could be ready. It's about making sure our city's prepared, our workers are prepared, our residents are prepared. And as we see more confirmed cases across the country, we know that we need to continue to do our part to protect our public health of all of our residents, particularly our most vulnerable residents. And while we still have no confirmed cases here in San Francisco at this time, we must be ready because we know it's coming. It's not a matter of if, it's really a matter of when. Last week, when we announced our local emergency, we committed to keeping the public informed of any actions that we're taking every step of the way. And that's why we're here today. Our director of the Department of Public Health and our director of the Department of Emergency Management will describe in detail some of those efforts, but today we are announcing a few important steps. First, our Department of Public Health has begun a new process to test for the coronavirus locally instead of relying on shipping the test across the country to the Center for Disease Control, or the CDC. This will allow us to move faster and confirm any diagnosis more quickly. Second, we are reinforcing our efforts to prioritize protection of our most vulnerable residents who are more susceptible to getting very, very sick and sadly dying if they contract the disease. This includes seniors, whether they are living at home or in congregate settings. Third, we are expanding our deployment of city staff to help our emergency planning and response efforts. We are committing 50 more staff people to help in this situation. These are members of the city departments that are considered disaster service workers to help with these efforts. This means more people doing outreach in communities and doing the critical planning to prepare for what we know is coming. These are just a few steps that we are taking to further protect the public from any possible situation. We all know there will be more as this situation evolves, and we are committed to communicating to the public on a regular basis to make sure that we are all on the same page. Now, I know that there is a lot of fear out there. I know that there's a lot of confusion and a lot of questions. And it's important that we don't panic. It's important that we get the right information and that we work with the public to address this situation. We are focused on trying to make sure that we contain any situation that would occur, that we protect public health. That's first and foremost. So we don't want anyone to jump to any conclusions or jump to fear, because we know that fear will make it possible that less likely people will come forward when symptoms do occur. Our commitment to San Francisco and to our residents has always been the same. We will do everything we can to protect public health. Ultimately, that's our goal. And we will be fully transparent as any situation occurs. And we'll do our best to keep you informed about how we are doing that. And I want to really thank all the city workers, especially many of the city workers who are part of the Department of Public Health, for all the work that they have done on monitoring those people who are staying in their houses in case they've traveled or may have come in contact with anyone. I want to thank the Board of Supervisors for supporting the declaration of emergency. And I want to really express that, these are very, very challenging times that we know, but we will get through this. We will get through this together. San Francisco has some of the best public health experts anywhere in the country. We have some of the best situations and equipment and things to handle situations of this nature. And so our goal, again, is to keep the public health, keep the public safe, and keep everyone informed about what they need to do in order to ensure that. And so with that, I want to take this opportunity to ask President Norman Yee of the Board of Supervisors to come and say a few words before we go into the details around public health and others that we need to provide you with.